For more, Dr. Julie Morita joins me now. She's a former member of the Biden administration Transition Advisory Board and the executive vice president of the Robert Wood Johnson Foundation. Before we begin, we do need to tell our viewers the Robert Wood Johnson Foundation was created by a J&J founder who still owns stock in the company. However, they are otherwise completely separate and independent entities. Dr. Morita, welcome. Great to see you again. Could federal programs like regular at-home testing be the key to getting us all back to normal? And how effective are these tests?
Hi, Tanya. Nice to see you again. It's a great question. I'm excited to see that these tests are available. There's a number of tools that we have to prevent COVID disease and transmission, and vaccines are one of the tools. Masking, social distancing are other tools that we can use. But when we know when you're infected, and if people isolate, and then we can quarantine people who've been exposed to them, we also can limit the spread of disease for those people who haven't been vaccinated. So to see that these test kits are actually available and that there's evaluations going on to understand how effective they are is really exciting. It's just another tool that we have so that we can actually help end this pandemic.
And the U.S. is, of course, still seeing an average of 50 to 60,000 new cases per day. According to a new CBS News poll, there are still a substantial number of people who continue to say they won't or might not get vaccinated, citing a range of concerns. How could this reluctance hurt the prospects for attaining herd immunity in the country? And what do you believe the administration can do to address this?
So in order for us to really halt this pandemic, we really have to have as high levels of immunity as possible. And some of that immunity will come from natural infection, so people who've gotten sick with COVID. But the other part of the immunity can come from vaccination. And it's really thrilling and exciting to see how well we're doing from a vaccination administration perspective. But there's still a high percentage of people who have not been vaccinated yet. And those people, some of them, are questioning and have concerns about the vaccines themselves. So it's really important for public health departments, whether it's at the federal, state, or local level, to really get into their communities to understand who's not getting vaccinated and why they're not getting vaccinated. What are the questions that they need to be answered so they can be comfortable getting the vaccines that they need? And a lot of that work is beginning and has been going on for a bit to actually address the questions and concerns that people have. But it's not like everybody has the same question or the same concern. And so it's really important to get into the communities and talk to people and hear what it is what information they need so they can feel comfortable getting the vaccines. We need for the highest levels of protection so we can actually stop this pandemic.
And Dr. Morita, of course, the last time we spoke, the FDA had put a temporary pause of Johnson & Johnson's coronavirus vaccine over reports of rare blood clots. The pause has since been lifted, and states will now continue to distribute the doses. What can public health experts do to encourage people to take the J&J shot?
I think it's really critical for people to understand why the vaccine was halted, what happened in that 10-day period of time, so that to reassure the public that the investigation that was going on, to understand how many people really had the problems with clots, to look at the numbers, to compare what is that risk compared to the risk of disease itself, and to make an informed decision about whether or not the program should continue or not. And that process, the process of identification of the side effect to begin with, was really remarkable, that we were able to detect this rare event, and the process to evaluate it within 10 days and make another recommendation to resume the program should be reassuring to the public. But individuals need to talk to their healthcare providers if they have questions or concerns, because that's who they trust. And the healthcare providers have the information that can help the individuals make the decisions about whether or not they should get vaccinated.
And now we are at a point, Doctor, where nearly 95 million Americans are fully vaccinated against the coronavirus, just over half of the adult population. More than a dozen states have now lifted their mask mandates. Do you believe that that's what should be happening, or do you think it's still too soon to take that measure?
So what I'm hearing through the grapevine is that the CDC will be releasing some guidance, updated guidance regarding mask wearing in outdoors. And I think that's what happens when we have emerging diseases. We learn new information, we get better evidence about when we can change recommendations or requirements. And so I think what I'm looking forward to seeing is what CDC's recommendations will be in the next week or so about outdoor mask wearing, because I think there may be an opportunity for us to limit we may not need to use masks as much outdoors, and CDC will have used the best available science to make their recommendations. So I think it's appropriate to adjust and modify recommendations when we have more information and science that supports it.
All right, we will wait and see what the CDC reveals. Dr. Julie Morita, thank you so much for joining us. We appreciate it.
Thanks for having me. Nice to see you.